India reported its highest daily death toll from COVID-19 on Saturday, 4,187, as the country's second wave of the virus tears relentlessly through the population. With around 400,000 new cases reported every day, it's the worst wave of COVID-19 to hit any country in the world. And it has overwhelmed hospitals, leaving people without life-saving hospital beds, oxygen and drugs. Some parts of the country are seeing the resurgence of COVID-19-induced black fungus infections, which caused many patients to lose their eyesight last year. Today, we address what needs to be done to help the population of 1.3 billion take an immediate response to save lives. For this, we're joined by Tina Thacker, Assistant Editor of the Economic Times. We also connect with Amit Kumar, Assistant Professor and Epidemiologist at the Center for Health Equity Research at Northern Arizona University. Thank you to both of you for joining us. And, well, let's go straight into the questions now. Tina, India's second wave, it's come as a terrible shock as the country saw infection numbers fall over the winter and the virus seemed to be relatively contained. So what led to this recent surge since mid-March, and what's different this time around?
That's true that India, we are seeing a massive surge in the number of cases. Also, the deaths, the fatalities that we are seeing are much more than the last wave. So some states that you would see in South and North are the hardest hit. The national capital, particularly Delhi, has struggled to contain the outbreak, which has overwhelmed this healthcare system. And many experts suspect that official death and case numbers are a gross underestimate in India. So we have seen everything going wrong in India. I think we declared a victory in the month of March, where we believed, including the government, believed that maybe we are just over coronavirus and it's no more there. And that's how we all let our guard down, which includes the government and from the public. There were no masks which were seen. People were gathering, in large numbers. And then we saw massive election rallies happening in India. So I think we were back. We thought that the virus is gone, but the virus had not gone. So we are just facing the brunt of it.
And Dr. Kumar, now why has the second wave of COVID-19 in India been so much more devastating than the first? And what's really causing the spread of these black fungus infections? And do you think these higher numbers, do you think it's also due to the spread of the new variant as well?
Yes, Young. So I will pick your second part of the question. So to some extent, we can blame new variant. During the first wave of the COVID-19 pandemic in India, local mutation did not play a significant role. But in the second wave, double mutant variants are known to be more infectious and lethal, affecting younger population and as well as children. The first wave of the COVID-19 was more widespread in geographical reach, with the hotspot mostly in the cities and metropolitan areas. During the second wave, the pandemic was more localized and spread to small cities, as Tina said, and which have limited healthcare resources. But back to the point why second wave of the COVID-19 in India has been much more devastating, because the rise of COVID-19 cases in the second wave was quite expected. Based on the epidemiological data, there were warning signs in February or late February, but the government of India and several state governments did not act on it and ignored the data projection. And government of India itself invited the second wave with a red carpet, and there are several factors that played a role. First, the Indian government declared victory against COVID-19 in February. That gave impression to the whole country that they defeated the virus, which encouraged complacency among the people. And second, after January, India and several other state governments promoted big religious gathering, as Tina mentioned, crowded election rallies attended by Prime Minister, health ministers, home ministers in March and April. And there were a lot of sporting events going on with the packed stadium, cricket games, matches. All these factors are strongly associated with the sharp rise of cases during the second wave. And as you can see, these events are happening, the cases are going up in the month of April and March. And the third point is you have to understand the historical perspective in India. There is a long history of broken Indian healthcare system. Indian government of India spends less than 2% of the GDP on healthcare compared to US and Western countries. They spend 15 to 17% of their GDP. Indian healthcare system is one of the worst healthcare system with no primary care and poor preventive care, a lack of public health infrastructure, poor quality of care, corruption, lack of accountability, and unethical care. And there is no minimum or lack of, I would say, evidence-based practice. So despite knowing the challenges of larger population and there was an inadequate public health preparation, and healthcare system was not prepared at all. And last but not at least, there was a lack of science and public health approach in fighting against the COVID pandemic in India. Large number of people are following in misinformation circulated in social media on prevention strategies supported by some religious leader, cult figures, and they were not using science while in preventive measure. So and also the government was not doing a good job and still not doing good job in reporting of cases. There is a lack of infrastructure or research institutes in India to study the epidemiological data or genome sequencing, which can find the type and cause of new variants and how it can be a lethal or damage. So all these factors are responsible for for inviting second wave of COVID in India.
Right, and medical workers, hospitals, they've been very hard hit by this virus, Tina, and there have been growing calls for a nationwide lockdown. Does this look likely to you? And how are people responding to the government's, or how the government's been tackling this second wave?
So last year, India had announced a nationwide lockdown, which affected the economy significantly. This time, government is taking its time, though the chief scientist at the WHO, who was the Director General of Indian Council of Medical Research, the health body here in India, she has said that the only way we could contain a virus right now is to announce a nationwide lockdown, which I don't see it happening because the government has now left it on the state governments. And many state governments have announced restrictions in their way and a kind of lockdown to stem the spread of the disease. So we'll have to see how it pans out. But as of now, I don't see this nationwide lockdown coming because of the reasons of the economy. And this time the government maybe doesn't want to take any chance.
And Dr. Kumar, now there's been a lot of talk about vaccines, and well, there's a severe vaccine shortage going on in India due to the constraints in the production capacity. And well, President Biden, though, he has backed the move to temporarily ease patent protections on COVID-19 vaccines, and this would hopefully help countries in need really quickly manufacture and distribute the doses. But how helpful is this in addressing the situation right now, Dr. Kumar? I mean, what needs to be done to really procure vaccines quickly enough for the Indian population?
Oh, that's a very good question, Suyong. And the decision of the U.S. administration to support a patent waiver for the COVID-19 vaccine is welcoming, but is not going to help a lot at this point of time. This will not increase production or distribution of COVID-19 vaccine right away in India. Even if technology made available immediately, it would take 9 months to a year to develop the process and commercialize those vaccines. This is a good start, but not a practical solution needed to battle this global health crisis at present level. 2 days back, India government changed its vaccine policy to allow Moderna, Pfizer, and Johnson & Johnson to deliver their vaccine in the Indian market. This was a good sign and very welcoming. Earlier, every vaccine got approval only after the trial in India. So with this decision, I think within maybe a week, we'll see Pfizer or Johnson & Johnson vaccines available in Indian market. And few more steps can be taken immediately to ramp up vaccine delivery process in India. Like first, to eliminate the trade barriers between the Western countries and India. Second, to improve the supply chain and scarcity of raw material. for vaccine development in India especially. And the third is willingness of all these Western countries and rich countries to start sharing their surplus dose with the poor countries. Not only Indians, there are some other African countries. And current vaccination rate in India is extremely low, almost 2 to 3% till today. And US have Oxford AstraZeneca vaccine, which has been tested in the Indian population and is currently used by Indian government. And that has not been approved in the US. So US can send those vaccines right away to India, so.
Exactly, so more immediate options available. And well, Tina, how do you see this? How do you see this move by President Biden as an immediate solution? I mean, when doctors and frontline health workers in India, right now, they're so overwhelmed with the inflow of patients and they're running short of beds and oxygen. What are India's immediate needs right now?
Yeah, so, India has been leading a push from lower and middle income countries at the WTO to do away patents on vaccines against COVID. However, this announcement, which has just come, does not mean that the patent rules will be waived right away. So the decision has to be taken by the members of the WTO, which will take some time. Immediately, it would be, we have just like right now inoculated less than 2% of our population. Given the size of the country, of course, the supply is a constraint. We have just 2 vaccines which have been approved by the regulator in India. So we'll have to just see how we are likely to get a new vaccine maybe by next month. And if at all we get Pfizer or Moderna or say Johnson & Johnson, that will really ease out the vaccine process, the drive in India. But we'll have to see how it goes about, because there are other problems which the multinational companies may face in India, because India doesn't give indemnity to the companies. So I fear, I don't know whether these companies would like to enter Indian market without this indemnity bond, which they have signed in other countries, say Moderna and Pfizer. And we'll have to see how this Johnson & Johnson also, pans out. So I think a long way to go.
But what authorities want to do right now is really bring these numbers down. And Dr. Kumar, when do you expect to see the numbers begin to taper? What are some vital steps that need to be taken right now at this point to really slow the spread of the virus, the second wave, and prevent deaths?
Yeah, that's hope I have that answer. But the second wave of the COVID-19 pandemic is showing no sign of slowing down in India. And this is not, we have not achieved peak yet. We are seeing more than, as you said, more than 400,000 of new cases every day and more than 4,000 deaths per day. And we can add 15 to 20% to these numbers because there is a significant amount of underreporting of infection and death rates in India. The Institute of Health Metrics and Evaluation at the University of Washington, Seattle, has projected about 1 million or more deaths due to COVID-19 by August 2021. And the Lancet has also published in their editorial last night. And in editorial, they have recommended 2-pronged strategy. First is aggressive and equitable vaccine delivery on a war front. And second one is to flatten the curve by implementing the same public health measures like strict masking, social distancing, ban mass gathering, and improve the testing. And furthermore, I would like to add, governments should use data science and epidemiological model to formulate the healthcare policy and decision at this point of time, rather than depending on politician views and opinion. And from the global community, we can expect that this should help India in building infrastructure or hospital or oxygen plants, sending ambulance, PPEs, and medicine. More international support is needed to build hospitals in small cities. So currently, India needs almost 2.2 million hospital beds and 400,000 ICU beds. I don't know whether India have right now or not. We don't have that number exactly, but based on this projection, they need 2.2 million hospital beds and 400,000
That is
ICU
a big
beds.
number. And Dr. Kumar, please tell us about your efforts as well to help these medical workers and patients in India right now, and also how people can get involved.
Yeah, as a being an Indian and I've studied public health and epidemiology here, and as a healthcare professional, both I'm kind of feeling helpless and frustration. I want to help back to my community, but and there are many Indians like me. They're helpless and kind of having a survivor guilt. And so, with the support of my friend Dr. Amit Vasist, he's a chief medical officer at Ballard Healthcare System in Tennessee. We have set up 2 fundraising pages on GoFundMe website and collaborated with American Indian Foundation, which is a well-established and reputable organization and have a long history of working in India at grassroots level. They are providing oxygen concentrators, ventilators, PPEs, and other medical supplies to hospitals in India. So that is going to help a little bit. And we have another third fundraising platform with International Society of Progression in Rehab and Education and Seva International. They are also working to distribute oxygen concentrators and other medical supplies across India. I'm also working with a local organization in Arizona, which is Indian American Cultural Religious Foundation, to find a way to channelize fundraising to mitigate this pandemic crisis in India. And this organization is working with multiple Indian cultural organizations across the US and already has raised almost 50,000 US dollar. And I believe that COVID crisis in India, it's need to be addressed with both immediate, emergencies needs for medical equipment, as well as building sustainable public health infrastructure to address the long-term needs, because we'll have almost 25 million COVID survivor. And again, as I said, Indian healthcare system is nowhere to take care of those 25 million COVID survivors.
Right, so these are just some very important and very immediate steps that people can take to help and meaningfully help, instead of just having these long extended political wishy-washy statements about helping. So, well, hopefully we will see more committed actions coming from leaders around the world. But I'm afraid this is where we'll have to end the interview today. That was Tina Thacker, Assistant Editor of The Economic Times, and Amit Kumar, Assistant Professor and Epidemiologist at the Center for Health Equity Research at Northern Arizona University. Thank you both so much for your time.
Thank you for having
So
us.
much.
And to our viewers, as always, thank you very much for watching.